My name's Ruth Spear. I'm a public health specialty registrar at Yorkshire and the Humber. I was a previous clinical leadership fellow, and that's how I met Kelda.
Hello, my name's Kelda Sheridan, and I'm the current leadership fellow for the School of Surgery. I first discovered making every contact count through Val and Ruth at the School of Public Health when I was working in the Health Education England Leeds office. Being from a surgical background, we hadn't had much direct exposure to the project, but having had discussions with themselves and other members of the public health team, I think it's a very worthwhile project to be involved in.
I suppose I'd heard about MECC in sort of abstract form years ago when I was previously a paediatric surgical registrar, but I think it's come to real prominence since the 5-year forward view for the NHS. And then when I was doing my leadership year, part of that was to scope out what was going on locally and elsewhere in the country around upskilling people that work in public services to deliver MECC.
I think one of the hurdles you face, particularly in a surgical setting, is a time pressure.
If you're delivering a very brief intervention or advice, it can only take sort of 30 seconds or so it doesn't have to take a lot out of the rest of your clinical day. One of the other major hurdles is the idea that it's not your job.
We are becoming more comfortable as surgeons having discussions with patients, for example, for a hip replacement, by saying you may need to reduce your weight or you may need to stop smoking, to probe further into other aspects of their life, which are just as important. We don't always feel comfortable to do as surgeons.
I would say that if you are delivering holistic patient-centred care, then actually if there's something that's affecting the health of your patient, then it is part of your clinical role to address that and try and support that person to improve their health.
I think there is a danger that it can be seen sometimes as confrontational, sort of telling someone you need to stop smoking, you need to lose weight, you need to exercise. I think if you have a different kind of conversation with a patient and explore these issues with them, a lot of them may already be thinking that, but they just lack sort of the support to be able to do something about it.
Changing your behaviour and what you do, it's a difficult thing to do. People often have to hear something several times before they get to the point where they decide that they want to make a change. If every consultant, if every healthcare professional delivered making every contact count and one person a year of the people that they see made that change, if you look at that across the whole of those patients that come into contact with those healthcare professionals, that can make a real difference.
I think one of the ways in which you can actually get MECC right was an example I was reminded of myself when I was thinking about MECC. We use quite a lot in ENT clinic an opportunity to have discussions with patients around lifestyle choices. The clinic consists of a clinician and often a nurse or a healthcare assistant, and the patient's relatives can also be present. The idea is that, for example, we would discourage the use of cotton buds to clean the ears. It has been shown that use of cotton buds and things like swimming can actually increase your risk of infections in immunocompromised or elderly populations. Simple measures such as this can keep a patient out of hospital and reduce the risk of long-term antibiotic use.
With a healthcare professional giving you that message, applying those risks to you personally can make it more real and actually get you to that point where you want to change. I think the future of MECC is going to be closely aligned with the new sustainability and transformation plans that are coming, because there's a heavy emphasis on prevention and the whole of the health and care sector working together to deliver better population outcomes.
I think the future of MECC is bright. I think we have a real opportunity here to finally tackle some big health inequalities on even a national level. And I think as clinicians we do need to engage with this process. We need to look at our patients holistically, and we need to realise that it's our responsibility just as much as it is our colleagues.
To deliver those making every contact count messages means that we can really make an impact at a population level to help support people from becoming unwell in the first place.